Well, let me say this at the outset. I know everyone wants to be done with COVID, but COVID is not done with us. And hospitalizations are rising. People have questions about new strains, new variants, what's this all about? And as we're approaching the fall season, we've seen a pattern when all respiratory illnesses start to creep up. But here in New York, we don't panic, we prepare. And I want to thank the incredible doctors and scientists for their effort, because now we have the tools to be prepared and deal with whatever the future brings. And we have the tools to manage the virus in a way that has little impact on your daily life to protect you from COVID. Because as governor, my number one job has been and will always be to keep people safe. And I want to thank people like Dr. John McDonald, who is one of the members of the team that I rely on for advice as we navigate the challenges that come upon us, whether it's a resurgence of new variants, whether it's dealing with ensuring that we have equity in our healthcare system. You made the challenge we face together, and I want to thank him for his leadership in this space. Without trying to trigger bad flashbacks, if you think back to March of 2020, our only recourse back then was to lock down, hide, surrender. The future was bleak. People were scared. People were feeling hopeless. But everything has changed. It has all changed. We are in a very, very different place. By the end of this week, New Yorkers will be able to get a new vaccine based on the strains, the ability to attack the new strains of COVID. And that's what we're talking about here today, which is why I've asked Dr. McDonald to join us. So before we get to the new vaccine, let's talk about the cases. Let's talk about where we are. Let's talk about the fact that cases are up. Yes, statement of fact, cases are up. Let's put that in context. If you look at statewide where we've been, the average cases per 100,000, 14, almost 15. That's the 7-day average. And you can see here, late August, the numbers are starting to creep up. Yes, that is a trend. That is what we have come to expect every fall. But that 14, almost 15 cases per 100,000 pales in comparison to at the end of 2021 when we hit 300 cases per 100,000. The second half of 2022, with the virus we thought under control, we were at about 50 per 100,000. So look at this curve. I mean, this is 15. This is a number that puts it in perspective. Let's check out the various regions. We always want to know what's happening in my part of the state, right? Well, Long Island and New York City are above the statewide average. A little confusing because we have 10 regions, but that bold red line is the state of New York. And yellow is Long Island, and the blue is New York City. So you just see them trending a little bit above the statewide average. But look back to December of 2022, when we were introduced the month before to Omicron. Look at the spike. Look where Long Island and New York City were just less than a year ago. So these cases, though, don't really tell the whole story, and here's why. People aren't reporting anymore. Remember the time when you got your test in a doctor's office or one of those large stand-up shelters? I mean, there was different ways to get tested because the test was so rare. Now you walk in and buy it in a drugstore, you test at home, you test positive, you're staying home, you're letting your family know, letting your office know. If you test negative, you just go on. So no one's calling in and reporting the real numbers. So that makes it harder to track and draw comparisons to the other days. But what tells the real story are hospitalizations. You can't argue or dispute the numbers of people coming in, presenting themselves into an emergency room or a hospital recommended by a doctor that they go there, because we can compare apples to apples in that situation. So here's the hospitalization curve, 7-day average. Again, you look back to July of 2022, August of 2022, over on the left here. December, we had our spike. And now, August, the end of last month, we're starting to see a rise. They've been ticking up since mid-July, but they're nowhere near their peak of what they had been at the end of last year and into January. So look at the curve. It's still well below any other point in the second half of 2022. Hospitalizations by region, again, it's Long Island, but it's the Mid-Hudson region that sit a little bit above the statewide average. Southern tier, Western New York, just a little bit below the statewide average. So, but let's talk about who's at risk. Who's presenting themselves to the hospitals? Who are we seeing? Well, the most consistent thing about hospitalizations, your risk is based on your age. 80% of hospitalizations are people 65 and older. And 88% of COVID deaths are people 65 and over. As someone who turned 65 a couple weeks ago, I'm not excited about these numbers, but I will be getting my vaccine very soon. So the good news is this should be reassuring to everyone. We know a lot more than we did about the virus 2 or 3 weeks ago, or 2 or 3 years ago. And we know how to spot it, we know how to treat it, we know how to lessen the impact, how to fight new strains, and how to fight the new variants. That's the fight we're in right now. And that's why this news is coming at a perfect time. My team and I just got off a call with the FDA confirming that the COVID vaccine is on its way to New York. Some doses shipped last night. We expect many more later this week. The updated vaccine guards against the newer COVID strains because it was built off the Omicron XXB 1.5 variant. That's what we're calling it now. It matches the new variants that are now dominant. So it's really a customized vaccine. It's offered by Pfizer and Moderna. And we are waiting to find out what age groups the FDA and the CDC were recommending should get the shot. Sometimes they would say people at risk, people over 65. In this case, they literally recommended that everyone 6 months and older should get a shot. You only need one, no more double doses. And again, they'll be starting here in New York on Friday. Doctor's office, pharmacies, healthcare providers. You can make an appointment online. That's still available. It just takes a couple minutes. And what I want to talk about is what's different about this vaccine and why should people get it? A couple of points. First of all, it is literally a new vaccine. It is not a booster shot. It is not an enhancer. It is a new vaccine designed to attack the new variants. A booster is a vaccine you get the same one over and over and over just to build up your resiliency. This is a new vaccine built specifically to match these circulating strains. So it doesn't matter if you've already been vaccinated. Take no comfort in that. Thank you for getting vaccinated in the past, but that is not protecting you today. You need to know that. You don't have the immunity built up over time. So as the virus evolves, this is where our scientists and researchers and companies have to get ahead of it. The virus evolves, so must our response. So here's the simple message, New Yorkers. Get the vaccine. That is the best way by far to protect yourself and those around you. And we're smart, we're resilient, we protect each other. We've done this since March of 2020. No reason to stop now. And don't think about just yourself because there's a lot of people affected. And one thing I want to point out here, which is troubling, all across the country, hospitalizations are on the rise for babies. We're seeing more infants having to be taken care of in a hospital because they're so sick. Now, for a young parent, that is scary, it is heartbreaking, a lot of uncertainty. You do not want your baby, your young child, to have to go to the hospital. So don't wait on this. 6 months is the age. Sounds young, but children get shots from birth. They can do it. I encourage everyone, don't let your baby be one that is in a cold, dark, scary place, unknown to them, scary for your child. Think about them and get them vaccinated. So they can't protect themselves. They have no choice. They're counting on their parents to do the right thing. But even for healthy adults, COVID is serious. You don't want to get it. And it could be the difference of just feeling kind of under the weather for a couple of days or being bedridden for a week or longer. So you don't need to do that. It is not necessary. I've talked to so many people who've had COVID. And because there was not a vaccine available for this latest strain, people felt really bad. So, but also for New Yorkers with pre-existing conditions, older New Yorkers and those with pre-existing conditions, it's really important because, as I mentioned, the hospitalization rate is high. So I need younger adults to talk to their parents, encourage them if their parents are over 65, remind them that it's simple, do it, and if you have underlying conditions, you really, truly have to do this because you are also in a point of vulnerability. So people don't realize this, but 70% of adults have at least one underlying condition, regardless of your age. 70% of adults have at least one underlying condition that puts you at greater risk of contracting a serious case. So it's better to be safe than sorry. And I do want to mention another vulnerable population, those who are our family members, loved ones in nursing homes. And I'm reinforcing that nursing homes are required to make this vaccine available to the residents. They shouldn't have to go out, go online, try to figure it out. They shouldn't have to go out and leave the nursing home. It needs to be available and will be available in the nursing homes. And today my office is sending a letter to every nursing home in the state reminding them of that responsibility. We also want to remind nursing homes the responsibility to stockpile tests. We have sent thousands of test kits to schools. We're also making them available to nursing homes, but they need to stockpile masks, PPE, because the whole idea of dealing with this is to be preemptive. We get ahead of it, particularly when it comes to our nursing home population. So every nursing home has to confirm to us, and we'll verify that they have stocked up. And if they need it, we have more from our stockpile. Same with schools. Two vulnerable populations. Older residents of New York, younger residents of New York. And 2.5 million children went back to school in New York last week. So they're not outdoors, they're indoors, sharing a lot of confined space, a lot of interaction with other children who are exposed at home. So we know there's a vulnerability here as well. It's our job to make sure that every school district has what they need to continue safe in-person learning, because we're still dealing with the fallout of what happened when children were disconnected from their normal environment, the effect it had on them emotionally, the effect it had on them academically, and they're still far behind. So I directed our team to make sure that all the schools are contacted, who needs more tests, who needs more masks, and we'll provide it. So let's get them stocked up as we're getting these early warning signs of what could be getting worse. Let's prevent any school outbreaks. And just another message on the available treatment. If you test positive and you want to avoid the longer-term consequences and a week or so feeling really bad, ask your doctor about Paxlovid. That is still available. It's at all the pharmacies, and it is still free, regardless of your insurance. So again, this is just like the vaccine. This is what we could have only dreamed about years ago. We were so desperate for a solution, a remedy, and now we have these treatments at our fingertips. But just to recap, this is not the bad old days at all. We don't anticipate getting there, but shame on us if we don't see the warnings, take precautions, be ready, and know that this can spread very quickly. So I'm calling on New Yorkers once again, as we have many, many times. Take the right precautions, and we can handle this. There's no need to be careless. We have the tools we need, treatment, tests, masks, but the best, most effective way to deal with this is getting the vaccine. It's coming, it's gonna be available, so let's use it. Get the updated vaccine. It's very different. Again, tell everybody, don't rely on the fact that you had a vaccine in the past. It will not help you this time around. So that's what I wanted to share. We'll be able to take questions in a moment, but before we do that, any questions for myself, or get more detail on the vaccine and what we're seeing with the strains from Dr. McDonald. I do want to say that beginning today, parts of New York's nation-leading gun law to protect New Yorkers are going into effect. These are part of our Concealed Carry Improvement Act, a special law we had to pass after the Supreme Court struck down my ability as the governor of the state of New York to protect our citizens from individuals with concealed carry guns. We had to respond quickly. We called back the legislature. We took strong actions. And of course, it was challenged in court. Last night, we received a positive outcome on the journey. Last night, Justice Sotomayor issued an order rejecting the latest attempt by individuals dead set on thwarting our gun laws. This will ensure that the Concealed Carry Act's improvements related to stronger background checks for guns and ammunition will remain on track. There was an effort to thwart this, to stop this, to get an order against it. As a result of Justice Sotomayor's actions last night, we can be assured and feel secure that our law is sound, that it is going to be implemented, and it also requires periodic on-site inspections of firearm dealers to make sure they're doing what they're expected to do. And this is just another way we can implement one of my highest priorities, and that is the public safety of all New Yorkers. So I wanted to make sure we had a chance to address that. Any on-topic questions first for myself or Dr. McDonald?
You, Dr. McDonald, had recently said to the Public Health and Health Planning Council that you didn't foresee a situation when mandates would come back. Is there any point, you and Governor Hochul, at which you foresee for hospitals, healthcare facilities, long-term care facilities, specifically instituting any kind of masking, vaccination requirements, given all that you said today?
We are at a place where we're seeing low numbers, not requiring such actions today. 14 per 100,000 is not something that raises the red flag. But we must be vigilant, and we are monitoring these numbers closely. That's my message, that we are watching this, and we're seeing a trend that is ticking upwards slightly as it happens in the fall. So I'll let the doctor respond, but our first offense is a good defense. We like sports. We get our defense by taking that vaccination now. And if that occurs in nursing homes and the residents are protected, that is the best way we can avoid the necessary changes that were in place when the numbers were really spiking out of control. Dr. McDonald, anything to add to that?
Yeah, thank you, Governor. You know, one of the things keeping in the back of your mind is we have a tool, right? And we have tools here. You know, where we're living with this right now, it's about personal responsibility, but also organizational responsibility. Personal responsibility, keep yourself healthy, get the updated vaccine. Organizational responsibility, hospitals, nursing homes, they have infection prevention experts. They know when to require masks. You know, I was pleased upstate hospitals a couple weeks ago put masks on with their employees. They had to do that for staffing purposes. You know, they have experts. I trust them to use them. We answer questions when we need to. Our job is to be vigilant, to offer advice, and just help people manage through this. Thank you.
Any other on topics? On topic, Dan?
I wanted to ask how you arrived at the idea that New York State has a remote possibility that they can get work authorization for migrants.
We'll get there. We'll get there. Can we do another one about COVID if there is?
Are you asking about COVID?
No, migrants.
I understand. I understand. Let's wrap up while we have the doctor here.
Hi, Governor. Anthony Carlo at Channel 7. Can you talk about how you're dealing with maybe a sense of the public thinking, you know, that we're beyond the pandemic, not maybe taking the new vaccine seriously and blowing it off? I mean, there's been a distrust from some members of the public since the beginning, and people have kind of advanced beyond that now. And there's just a second question I have. The number of hospitalizations, specifically right now in New York, if you could give us that.
Sure, Doctor had that. As far as people wondering what this is all about and should they follow the guidance to get a vaccine, the alternative is being sick. And so I think rational New Yorkers who are not listening to extreme voices that question the efficacy of vaccines, of the normal New Yorkers who understand that this is a way to protect themselves and the family, I believe that they're paying attention now, because everybody now knows somebody who had COVID recently. I think it was in the recesses of our minds for a long time because we weren't exposed to anyone who had it. My daughter had it last week. My son-in-law had it last week. My neighbor had it last week. People in work have had it. Many of my commissioners have had it. So the reality is setting in. So people are actually saying, oh, it's back. And that helps our job, because we're not talking about hypotheticals. Oh, this could come back someday, so get ready. It has come back. Now, the reason it's not severe, we're not going to see as many hospitalizations, we believe, is because people understand. I've seen more people wearing masks voluntarily, taking precautions on their own. They may be not going out as much. They're just kind of being a little cautious about this. But what is going to be the game changer is Friday, when people can go in and get a vaccine in a couple of days feel very confident again. So I think there'll always be people who mistrust. They probably mistrusted before, and they probably never got a vaccine in the first place. But to the tens of thousands, millions of New Yorkers who were vaccinated before, they've done it once, they probably had boosters. We're saying just do it again. You get a flu shot every year. You should get a flu shot every year. It is flu season. RSV, we've seen extreme cases, especially in our children. Make this part of your routine health maintenance every fall, because this is the new normal. Not to be afraid of it, but just get the vaccine like you would, and then you don't have to worry about losing time from work. If you're a low-wage worker who only gets a check by showing up to your job as a waitress, you want to protect yourself. You want to make sure that you don't get sidelined and have to stay home recovering for days. So it's a challenge, but I believe that with the help of the media, talking about the importance of this, getting the message out there, amplifying what I'm talking about here today, will make the progress we need.
Any other on topics?
Hi, Amanda
You had a
Dubas.
question about how many hospitalizations, so. Total.
Yeah, so I don't have the total number on here, but I will say the rates have been going up last 6 weeks. And one thing to keep in mind, about 60% of the hospitalizations right now are from COVID as opposed to just with COVID. And that's been upticking slightly as well. And, it's really about protecting someone's personal health. I know the uptake on the updated vaccines last year wasn't what I'd hoped for, but really I think people need to look in the mirror and say, how do I protect myself? That's what I'm helping people. The virus changed, now the vaccine has changed. And that's all we're doing here. We're just up to date now. The virus changed, now the vaccine is up to date. So I'm encouraging people to get it.
Amanda D'Ambrosio with Queens, New York. I wanted to ask a question about the BA.286 variant. I know the WHO has spoken about some concerns about this variant, and it's been detected in New York City wastewater. Can you talk a little bit about the state sequencing efforts and whether or not we've discovered any more of these cases?
Good.
I would love to talk about that. Yeah, thank you for asking that. So we do whole genomic sequencing in the state. In other words, we're looking for BA.286. We've seen it so far in wastewater. Of course, wastewater is water flushed down a toilet, so we've seen it there. We haven't seen it in people yet in New York. Doesn't mean it's not here, but we're looking for it. Why do we do surveillance? We do surveillance to see if we can find it. I'm not super worried about BA.286. I'm being vigilant about it. Why did the World Health Organization care about it? It had a lot to do with it was just so different. In 2023, we've been dealing with all these Omicron subvariants, and that's what 23 was about. But when you look at BA.286, it's actually not a subvariant of Omicron. It's different. However, fortunate for us, the new tool we have, the new vaccine does have activity against BA.286. And fortunate for us, Paxlovid will work against BA.286. And fortunate for us, although it's in 11 countries right now, it's not taking off like wildfire. So I'm keeping track of it with my team. We're being vigilant about it. But so BA.286 is on my radar.
All right, I think we have time for about 2 off topics.
Governor, you
Yes, sir.
said that you were planning to meet with legislative leaders yesterday. I know that Speaker Hasty was in your office yesterday. Where are we with the special session, and are you willing to call an extraordinary session where you set the agenda? Where are we with the potential special session when it comes to the migrant crisis and potential state-level work authorization?
That's a pretty full question, so let me break it apart. The answer is yes. I did not hide the fact that I have regular meetings with the leaders. I'm on the phone with them. We're talking about issues as they develop. This is not just a relationship that is during the legislative session. So we talk frequently. We get together in person frequently, casually, socially. These are my partners. So I invited them to come to have a full briefing on a number of issues. We talked about other issues as well, and got around to addressing what options the state may have with respect to dealing with the migrant situation. Now, one of them is money, and we already did that. We allocated $1 billion in the budget. We actually have now committed to an additional $700 million, because I don't know that it's widely understood that when people talk about places where migrants are being housed, like 2,000 going to Floyd Bennett Field, which we worked very hard on, people going to Randall's Island, people going to Creedmoor, people going to the JFK hangar, people going to the former correctional facility in Harlem, those are all paid for by the state. So when people say the state needs to do more, I say we're paying for these large-scale sites. We're also paying 29% of all the other housing costs Plus, we're spending $200 million thus far and rising on the National Guard. So people shouldn't take for granted that we would pick up the cost of sending people there to help run these facilities, National Guard. We're also paying for legal services and have been for a long time. And now we're re-upping money to pay for enhanced case management. We have not had the data, and I want to be really clear. We asked for numbers. We want to know who these people are, where are they, what is their status? Do some want to go back? Do some have a friend somewhere else? They don't know how to get there in another state. So do some of them already qualify for work because they filled out the Customs and Border Patrol app before they arrived and could work within 30 days? So there are different classes of people, but they have not been tracked. So we have been pressing the city and the White House to share the data with us so we can lend a lot more help to that effort of dealing with the back door of this. We have people coming in the front door. The back door needs to be open wider. And the way to do that is to use case management, and we just allocated another $36 million for that. So we talked to the leaders about the resources that have been on the table, assuming more responsibility for payments that we didn't anticipate during this session, and how this works. We gave a down payment to the city of $250 million. Draw down that first, $250 million. Thus far, they've submitted receipts for $189 million. So we still encourage them to submit the receipts for that much. There is much more coming. So we talked about if there were to be a session, what would be involved, and we're trying to game out and figure out, what is the objective of that? There has to be an objective. I mean, of course, I can call anybody anytime, but it has to be for a certain objective. What I did talk about was, for the first time, just entertaining. Again, entertaining does not mean a decision has been made. This means I'm sharing my thought process with all of you who are very interested in how this is evolving. I'm sharing a thought process which looks at, as I said last week, entertaining all my options, all of our options. And we have to look at what would a session do? What would not a session do? Do we keep funding? Do we take on more responsibility with the case management and asylum processing, which we are doing? Continue to press Washington. And top of mind is pushing even harder with urgency to the federal government to grant temporary protective status to Venezuelans. At one time, about 50 to 55% of the migrant population were people coming in from Venezuela. They are fleeing Venezuela because their economy had collapsed. They were once a thriving country based on an oil economy, which has now been brought to its knees. They have political chaos. They have leadership, political leadership that is persecuting people. They have reasons they're leaving Venezuela. We are pushing the White House, once again, resuming my daily call, let them have temporary protective status. It's now about 40% of our population, but just imagine if 40% of the migrant population was granted this status, could work within days. I have 460,000 open jobs in the state of New York, 5,000 farm jobs today, because I have a harvest that is in jeopardy of not being brought in all throughout the state of New York. So we have a path. I want that temporary protective status. I want an expedited work authorization. I want more money from the federal government. I want more help that we asked for at the White House, which we're going to be getting, more housing vouchers, monetary assistance to help cover some of the transportation costs, which we're absorbing, also more money for human services and a couple of other areas. So we have a whole list of things we've asked for the White House, but I'm moving right now almost to the top of that list is work authorization is there, but do the temporary protective status for Venezuelans, and all of a sudden we can start seeing people leaving shelters very quickly. So all this was talked about. I want to make sure that the leaders knew everything my team knew, make sure they have a good briefing. They got a briefing on the budget last week from my budget team on what this could do to next year's budget with the commitments that we're already making. Just so everybody goes into next year with their eyes wide open. This will have an impact if we don't start seeing more people leaving the shelters and not being replaced with 2,000 to 3,000 coming in a week. So I'm working with the mayor on this, by the way. Our teams are speaking all day long about what our options are, what we should be doing. And certainly there are options on the table that we're talking to him about. So that does not mean there has to be a special session, because I'm doing all that outside of a session. So we just talked about whether that is necessary, what would that actually give us, and will it move the ball down the field? And we're talking about it. I'm just not here to say and share with you a decision has been made, because one has not.
We gotta
Very,
go.
very
So
briefly,
last one.
just very briefly, just because you had raised a prospect of state-level work authorization yesterday, there are at least 2 bills in the legislature right now that would do some version of that. And yesterday there was a White House briefing where the White House said, we discourage states from doing this. Where do you stand, and is this something that you discussed with leaders yesterday about pursuing either that legislation or something that you might introduce yourself?
I shared this at the White House during my 2.5-hour conversation, a couple weeks ago. I said, you need to know where I'm at. We are in a situation where the status quo will not hold any longer. Unlike all the other migrations that brought people from every corner of this planet to this city, to this state, over the history of our state, unlike all of those, when people arrived, they could work right away. My grandpa, very poor, was a migrant farm worker in the wheat fields of South Dakota. Grandma was a domestic worker. They were teenagers, they had nothing, fleeing great poverty. That's the story that is being withheld from these individuals who are here because they don't have legal work status. So there's a path. There's an easy path forward if the White House, and I'm going to say this loud and clear because this has not been reported, Republicans run the House of Representatives. Okay? Speaker McCarthy, other than wasting his time pursuing idiotic ideas like impeaching the president based on nothing, ought to bring back the Republicans, of which there are 9 from the state of New York, who should be feeling this and hearing about this instead of calling on us to do something. Immigration is a federal problem. It calls for a federal solution. President Biden has bills out there, ideas out there, on how we can work together with the Republicans, and they won't get back to work and deal with this. So that's another frustrating problem we have. So I wanted to make sure the leaders knew what's on my mind. We talk about the bills, we can talk about everything, but right now it is in conversation state. And I'm aware of what the White House has said, and I'm saying it's a federal problem. We need your help. Do something. So I'm looking at possible language. I want to make sure it's going to be successful. Some states have passed, not in this certain current environment, but over past years have passed state work permits, but they've all required federal authority. That is factually true. That's the confines I'm working within. But I can tell you right now, we are leaving no stone unturned to find some way to get these people out of the shelters, into legal jobs, and get them part of our economy, because I have every single day, Republican and Democrat, business owners in every corner of New York asking us to give them opportunities to let these people work for them. So we can solve both problems. The humanitarian crisis, give these people what they came for, and take care of a real problem our economy has, which is a severe shortage of workers. The answer is right there. Republicans in Washington ought to get their act together, show up, do their jobs, stop pointing the fingers, and actually do something useful for once. Thank you, everyone.
Thanks, everybody.
Would you consider doing that without?
I'm considering all options.